झरनों से संगीत है झरता, झरनों से संगीत है झरता, पत्थर के टकराने से तूफान भी तोहफा बन जाता, तुमको मीत बनाने से प्रभु, तुमको मीत बनाने से। झरनों से संगीत है झरता, पत्थर के टकराने से तूफान भी तोहफा बन जाता, तुमको मीत बनाने से प्रभु, तुमको मीत बनाने से। सागर देता, पर्वत भी झुक जाता है, सागर रास्ता दे देता, पर्वत भी झुक जाता है, नामुमकिन मुमकिन हो जाता, वक्त भी रुक जाता है। हम जाने या तुम जानो, हम जाने या तुम जानो, क्या मिलता प्रीत लगाने से, तूफान भी तोहफा बन जाता, तुमको मीत बनाने से प्रभु को मीत बनाने से। याद
So good evening, let's start.
Good evening, everyone.
Yeah.
Hello, hi. Good evening. Good evening, ma'am.
Yes.
It is with great joy and It is with great joy and heartfelt warmth that I welcome you all to this much-awaited special session on preparation for MD, MS exams during first, second, and third year, and interactive session. This meaningful event is brought to you by Divine Sanskar Research Foundation, Panvel, in collaboration with the medical wing of Brahma Kumaris, Mount Abu. Tonight, we gather with a shared mission to uplift, empower, and support our dedicated resident doctors who embody the true spirit of service and perseverance in the field of healthcare. Your commitment and resilience are nothing short of inspiring. We are deeply honored by the presence of two distinguished medical professionals whose experience and insight will be guiding lights for all of us this evening. Dr. Aarti Chitkara, consultant gynecologist at Civil Hospital Panipat, Dr. Adarsh Pal, MD in medicine from the esteemed AIIMS, New Delhi. A special word of appreciation goes to the coordinators whose dedication and efforts have made this session possible. With immense pleasure, I now invite our dynamic coordinators, Dr. Sejal from MGIMS and Dr. Lekhi from IGMC, to take the lead and carry the evening forward. Over to you.
Thank you, Lakshmi. Thank you for the introduction.
Thank you, Lakshmi.
Thank you, ma'am.
So, good evening to one and all present here. Going ahead, I would like to introduce our conveners for today. Yes. So, good evening. It's an honor to introduce Dr. Alka Patankar, ma'am, Professor and HOD at IGMC Nagpur with over 33 years of experience as medical educator and expertise in prenatal diagnostic. Ma'am brings unparalleled dedication to women's health and counseling. She has been recipient of prestigious Lokmat Maharashtra of the Year Award, Doctor Category 2021. She has also been a reviewer of Journal of Obstetrics and Gynecology of India. Ma'am's contribution to medical education and healthcare are truly commendable. We welcome you, ma'am.
Next.
Our next convener for today, BK Dr. Shubhada Neel, Medical Director of Neel Hospital and ICU, New Panvel, Navi Mumbai. She has also organized more than 15,000 Divine Garbha Sanskar workshops across India, touching more than 1 lakh lives, expectant mothers and family members. Divine Garbha Sanskar YouTube channel, online viewers, more than 50,000 with daily online sessions, with trained over 3,000 gynecologists, 2,000 plus nurses, and 2,000 plus Asha Anganwadi Sevika workers, organized more than 200 national conferences, webinars, seminars, and workshops for the same. We welcome you, ma'am.
Thank you, Sejal. So with that, we start the today's session, and as we know, we have two important speakers, and they are very expert in their own field. Dr. Aarti Chitkara, and she is convener also of this series. Dr. Aarti is a consultant of Gynaec at the Civil Hospital Panipat, and as you can see, she's been awarded with many awards, and among that, Torrent Young Scholar Award 2019 and Dr. Karan Gupta Memorial Award at AICOG 2023. Many publications to her credit and multiple chapters in Foxy book series, AOGD Bulletin. And what I, the most important and which appealing to me is personal interest in physical fitness, meditation practitioner, and the volunteer with various NGOs. So welcome you, Dr. Aarti. I think we'll welcome Dr. Adarsh also simultaneously, and then they can take over. So next slide. So welcome Dr. Aarti for today's session.
Thank you so much, ma'am, for that kind introduction. Thank you, ma'am, for having me with you.
And the second speaker for tonight's session is Dr. Adarsh Pal, MD Medicine from prestigious AIIMS New Delhi. Previously, he's been earned MBBS from AIIMS itself 2022, and having joined in 2016. His areas of interest include internal medicine and medical education. So that is very important, because with everybody is busy in the clinical practice and focusing on that, but you are focusing on the medical education with focus on simplification of the complex concept, encouraging collaborative learning and use of technology in learning. With AI coming in, we all of us have to be, knowing about this technology in learning. And what is more appealing to me, and the important is he secured All India AIR 1 in MD INI CET examination. So heartiest congratulations, Adarsh, for that. And both these publications and the MD thesis, which is the topic which is close to our heart, and Dr. Aarti will also agree to it. Then that's why I think you are with us among all the gynecologists here. So the publication and the MD thesis on the topic, which is the effectiveness of the enhanced behavioral interventions and the use of continuous glucose monitoring technology to improve the pregnancy outcome in women with type 2 diabetes mellitus through a 3-arm parallel randomized controlled trial. And with this stress increasing, we are facing nowadays all medical complications, be it diabetes or cardiac problems during pregnancy. So both these topics, your publication and MD thesis, focusing on all topics, so that is really creditable. So with that kind words, I welcome both of you, the Adarsh as well as Dr. Aarti, for today's this series. And please, I hand over the mic to you. Thank you so much.
Thank you, ma'am.
Yeah. So we start with Dr. Aarti's session. You want to
ma'am, I think we can start with Dr. Adarsh. My network is little poor. In few minutes I'll be in a better place.
Okay.
Thank you, Dr. Adarsh, first of all, for joining us, and congratulations for your NECET results. Thank you for coming and talking on this very important topic. Please take over the stage.
Thank you, ma'am. I'll just share the PPT. Is the screen visible?
Yes, it's visible.
Perfect.
So we'll be discussing about how to prepare for the MD final exams, and I'll share some of the experiences and lessons which I've learned over the 3-year journey of the MD medicine. So the learning could be divided in the first semester, in the intermediate semesters, second to fifth semesters, and the learning in the last few months, which is the final semester. So the first semester is usually hectic. You will not get persons will not get separate time for the learning or reading things. So the goal is to adjust to the department, learn the basics of the ward management, and basically adjust to the department is the goal, so that they do not leave the department or they do not have any overwhelming mental stress. And learning usually happens passive, since there is a lot of scut work. Also, you have to shift the patients, you have to arrange for the investigations. So all these things happen simultaneously. So the learning is usually passive. You do not get active time for reading and then learning the topics. So it is important to pay attention on the rounds and learn from the seniors. You have to actively ask questions. So if you are asking the questions from the seniors around and discussing with your friends about if any doubt is coming, then the learning can be improved. So this is very important for the first semesters. As you move from the first semester, or in some colleges after the first year, so things become less hectic. You are more involved in the patient care, direct patient care. The skirt work is slightly is reduced. So the learning starts actively. You start reading about the patients. You start actively reading the books or the review articles or some resources like Up to Date. So the important thing is to read at least about one topic about the patient that you are actively seeing. So it may have various involvement of, it can be multisystemic involvement. The patient be having multisystemic involvement, but make sure that you read at least one topic a day. Do not make your goal ki I'll read everything about this patient. So that can be overwhelming. And for the overall management of the patient, you can do a quick review of the using Up to Date. So here in AIIMS, most of the people are using Up to Date. AI also is coming. So AI in ChatGPT, you have to use cautiously. You have to verify it. But for the preliminary things, you can use AI to find the evidence, research articles quickly, so that you can give evidence-based management, because the evidence is changes rapidly very much, especially in the evolving fields like medicine as well as in obs gynae. And then you also have the subspecialty postings. So there you have to learn specific systems like cardio gastro. So there you have to pay attention to when you attend their rounds, you're involved in the patient care. So that is important. So intermediate semesters, you have to be active in learning. You have to read one topic of the patient at least daily when you're seeing the patient. When you have free time, then you can go through the rare topics or the other topics also. In the learning in the last few months, that is the final semester, then obviously if you have learned in the intermediate semesters, then most of the topic you would be knowing. Just you have to prepare them exam oriented. So I'll discuss more in detail. So the learning in the last few months is exam oriented, and you can go through the previous year's questions. That is very important. So the first experience is key. Almost everyone is passed until anyone is putting efforts for failing the exams. Like if you are actively arguing unnecessarily, or you're missing the exams because of any reason. So missing the exams can be because of the physical health or the mental health. So that is very important that you keep track of that. You keep them healthy. So do not worry too much about the exams. Make consistent learning efforts. So you should be not leave everything for the final semester, that I'll read about the theory in the final semester. So you are seeing the patient, as you are involved in the patient care, read some topic, some part of the topic or some chapter related to your patient care. And mostly every common topic would be covered by the time you would reach the final semester. And it is important that even if you fail, it is not the end of the life. So the important thing is to set the goal. So don't set the perfectionist goal like topping the exams or completing cover of the textbook or syllabus. So these goals would unnecessarily increase the stress. So you have to prioritize health, then you will only be able to learn. And it is a marathon, like right from the first semester till the last semester, you slowly increase the knowledge. It is not like it is not like MBBS where it is mostly theoretical. You are not doing the practical thing. In the MD or MS, you are doing the practical aspects. You are seeing the patient, so you are learning slowly by slowly. So if you incorporate the theoretical part also by seeing the evidence, recent evidence about what patient you are seeing, so at the end you would be knowing, even though you cannot formulate in a specific pattern that is asked in the exam, but you would be knowing most of the things. So set the practical goals like complete the previous year's questions. Uh, this is the previous year's question. Completing previous year's question is must for all exams. Any exams you are preparing, even for the INI set or for the MD exams. So previous year's question you must do. And going through the recent advances that are usually asked. And read common disease topics in details. That would be useful for your cases, also for the general management of the patient. They are common, so you should know them, even the rarer part of them. And that would help in the exams also. The third thing is previous year's question. I would emphasize again that almost 95% questions would be repeated even in the final exams. So the PYQs are actually important at common topics. So do not miss them. So do not start reading from the rarer topics or that you haven't read, that I rarely ask. So first start from the common topics, common like in medicine, like CKD, heart failure, MI. So first master them and master every part of them, even the recent advances, everything. In the final year, start with first attempting previous year's questions and not ending preparation with it. Usually we make the mistake even for the INI set exams, or I'll do the previous year's questions and first I'll read the textbook from starting to end, or I'll read the notes, or like that. So my strategy has always been ki first you go through the previous year's questions, you read about their answers. You do not have to learn them or memorize them at ki pakka se yaad hi kar lena hai, but just see the previous year's questions, go through their answers, read the related topics, and then once you have completed them, then you can read the remaining topics, or you can read the book from the start to the end, or you can read the notes. But make the PYQs the priority. This will give you a sense of confidence of completion, that you have at least mastered what has been asked previously, and this will usually cover 95% of the topics that is there in the textbook. The fourth important thing is keep the learning, especially till the 5th semester and also in the 6th semester, it should be patient centered. So the patient that you are seeing, the questions that are arising while diagnosing them, while treating them. So you have to read that. Do not read randomly any topic. So this way you align your topics. If the patient has 10 problems, you can read about 1 or 2 problems at least. In detail, one problem at least in detail from the book or the any resource like up to date or the recent review article, and the other problems that are related to the patient, obviously you have to solve them, so you can do a quick review about them from the using AI or using up to date or using textbook. Even you can search in textbook. So that short things you can do, but one topic you should read in detail, and it will increase knowledge exponentially by the time you are there in the final semester. And the most important thing is while you are learning, patient-centered learning, involve the discussion with your colleagues and the seniors. That is important because you cannot learn individually everything. So the inputs of the seniors, inputs of the colleagues are important. They might have read something else about the same topic. They would give you inputs. You can verify them, but that is very important. Discussing. You will remember more if you are discussing. The resources that you can use for the learning can be up to date. It provides an evidence-based resource. The review articles use help of AI to search quickly. You can use PubMed also, but there are now AI tools that you can use to research articles faster. The standard textbooks are always available. And then the academic presentations usually are held in each department of the colleges. So you can use them because they usually have a good summary, have a good detailed and good summary of all the recent evidence also, and from the basics also, from the various combination of various textbooks. So academic presentations you can also use. I have also used in my preparation during the final MD exams, this academic presentations. This is the most important thing that I would want you to take from this webinar, is that the learning should be collaborative, not individual learning. So you have obviously you would have 3 or 4 residents, your seniors or juniors, at least in your department, in your unit, who would be with you. So try to teach each other different topics, discuss each other different topics. That would enhance your knowledge, enhance your retention. And also, this is like amplification of knowledge. You have to learn one thing and you would be receiving in return the knowledge from the 3 or 4 individuals and their perspective about a patient related topic, or in a journal if you're discussing a topic. So this is very important. Usually I find it's missing in almost every college or in every department, including mine. Matlab, I try to we are collaborating, we are discussing topics with each other, or even teaching each other topics. That is very important. Second, in the same way, while we are making notes, uh, like exam oriented notes for the like just passing final MD exam, that is not a competitive exam like someone would want to hide the notes or something like that. So it collaborates. Everyone's goal is to clear the MD exam. So like I during my preparation made the notes on the OneNote. So जो मेरे डिपार्टमेंट में जो मेरे यूनिट में पीजीज थे, देवर पीजीज, सो आई हैड गिवन वी हैड all the access to the OneNote, and everyone was adding the topics that they were reading. So their concise notes were uh, we would be able to make quickly, and also we do not have to read every topic from the any n number of things. So one person can read a topic from 3 or 4 textbooks and then can make the notes like that, and then the other person would be able to read that. So that is very important. You have to collaborate from the first semester, like when you are seeing the patients. If there is a problem, if you think there is a problem that needs to be addressed, you are not understanding it, discuss with your peers, discuss with your seniors, learn about it, and then teach others also. Then you would retain it more for the longer time. And the last thing I would say, the AI is coming, and it is proving useful now. You can use AI in the patient-centered learning. Like you can first in the till the 5th semesters, or till the 6th semesters, for the patient care, you can ask questions. At least sometimes it gives wrong answers also, so you can ask for the references and go through them. So it eases the job. Do not any just take whatever AI is saying. Use the reference, see the reference it is giving, and review that. But it eases out, it makes it quicker to search for the evidence for your patient management. So you can quickly review the differentials and search for the latest research evidence for a patient-centered question. And for the exam-specific preparation also, it has become very easy. So previously, if you had to write like 10 marks question, you have to frame a 10 marks answer for a question for a rare topic like that has been asked, like heat stroke or something like that. Rare topic means any that you usually ignore, read at the last time, or that like. So that topics, it would give a summary. You can make your own bots, like you can insert the PDF of the book like Harrison or something, some super specialty book like Schlesinger, etc. And then you can ask it to frame a 10 marks answer, write a 10 marks answer with the headings for exam. So it will give a ready-made answer, and that we all had tried, and it was giving good answers. Not matlab, it was giving good answers, and with the references from the Harrison or the book you are saying, or from the up to date. So it quickens the job. Earlier you have to frame the answer in the mind and then prepare for the exam. This AI has made that part answer, and so we have to use it so that we do not waste time in making notes and preparing for the exams. So now it's stop sharing. And I would want if there are any questions. Hello?
Yes, you're audible.
Sejal?
It was a wonderful PPT actually, and we are trying to do collaborative learning right now. Even our professors like you should read one topic and discuss it with your colleagues, because that's the only thing we can do right now. There is actually no time to read anything. Whatever in case we are trying to do, like look after that. That was one great point. And even like having up to date and using AI to the maximum for reading books.
इसको because one person cannot read everything.
Everything.
It's not
Definitely.
possible. So for to quickly gain knowledge, we have to learn from each other. That is important.
And being in first year, only skirt work will help right now to learn anything and everything. Nothing else matters right now, I feel.
Hi. Only what did you say? Would you repeat again?
Like, I'm in first year right now, and only word work, paperwork, how to write, like documentation, basically right now. And then later, like different things, reading wise.
हाँ, that is important. मतलब that we have to do. मतलब that is a part. वही है कि डायरेक्टली बुक्स तो उस समय रीड नहीं कर
नहीं
सकते.
कर सकते वही मतलब जितना जो एक पॉइंट था कि like you have to actively ask questions or like ask your seniors. That is the only part where you can learn. There is no other way to learn in first year. That is true.
That is true.
That is true. Experiencing it right now.
And in first time we do not also have to set goals like I'll see the patient, I'll read everything about it, because that will overall add you मतलब affect your sleep, and give you more mental
True.
pressure. So try to learn when you are in the ward मतलब from the seniors,
Like at least one case.
and then have adequate sleep मतलब if जितना possible हो पा रहा है, because passing sem is थोड़ा difficult because you are already adjusting to the department and the field. From the MBBS to MD, it is a transition because MBBS it's थोड़ा सा chilly होता है most of the
What होता है?
places, but MD, even on the Sundays, first time you realize that you're not having holiday, you have to go to the hospital, and the same
Good.
things, and you do not have a break any day. So that
There is no break.
different from the MBBS time. So
Adjusting.
yeah.
Thank you, sir.
Thank you, Dr. Adarsh, for this exhaustive presentation. Like you've covered, I think, everything from the basics of first year to using up to date to using now even AI. So honestly, like when I was doing residency, I think AI was not a part of that. And I'll be speaking as in when we go ahead, it'll be an interactive session. And I don't have a presentation for you all. It is just going to be a good interaction where I would want you all to respond and ask your doubts and questions. Since Dr. Adarsh has already covered and in a very exhaustive manner how to go about, what to do, how to segregate your residency into 3 years and then give your best inputs. So I learned from Kriplani ma'am, like she was ex-HOD AIIMS. Ma'am said, okay, we have a question before that. Let's take that, Sejal.
Yes. So the question is from Meena Devi. So in second year, how should we cover the entire syllabus? Should we go on previous year question paper or previous year question paper ka topics? Should we go topic wise or should we go question wise?
I think in second year it is too early to start for the exam specific any oriented preparation. I think you should go by the patient centered. So every patient would have any here also, and in every college also, the patient would have multiple of problems and they are complex. Sometimes we just ignore even the simple problem like anemia. Well, even if ask anemia approach to many residents, they would be just writing anemia. So they would not be any confident whether it is anemia of chronic disease, IDA, or a combination of any multiple things. So you have to read patient oriented. You may have to make a problem list what the patient problem is having, and then you have to read that only. It by the end of fifth semester, you would have covered the topics any segregated wise different places. By the end of fifth semester, you would not have read them like from the first chapter to the last chapter, but you would have read. So I don't think you can see the previous year's questions if you're worrying about the exams, but even if you read about the patient centered, you would cover previous year's questions. So you do not have to cover the entire syllabus, because do not fall into that trap of covering the entire syllabus. Read about the things which you are seeing in the ward first.
Well said that. Any more questions? Anybody wants to ask anything? Okay, so moving ahead with a little bit of OBGY. It's a lot of things are in general that we need. Kriplani ma'am used to I consider ma'am as my mentor, and I learned one thing from ma'am. Ma'am always said कि books जो सिखाती हैं वो सिखाती है. That stays in the books. It stays in your mind. What skills you learn is taught by your patients. Always go back and follow your patients. For example, as simple as giving an episiotomy stitch, a suture. You might have read the technique. There would be your seniors teaching you how to give episiotomy. Initially, you would take 30 minutes to suture that stitch. Maybe gradually you will improvise on your technique. You will be fast, you will be quicker. But how do you know whether you're giving the right stitch to the patient or not? Nobody's going to teach you. Nobody's going to handhold and teach you this is the exact method. Your patients are going to teach you. Go back, follow your patients in the PNC ward. Usually what we have a habit, like we are so much bogged down with the work of the ward and residency, documentation, writing vitals, taking morning rounds, evening rounds, preparing discharges, that we fail to interact with the patients. We don't go back and follow. Suppose the patient I delivered got shifted to some other ward, some other unit. I did not follow my patient. I will never learn whether that stitch that I gave to the patient, was she healthy? Was it the right method? Did the wound approximate on its own or not? Suppose I did a cesarean. If you're not following your patient till the discharge, you will never learn the post-operative course. Today we like I'm also into a teaching platform, so residents, when they want to join after their MBBS, they will base their choices. Suppose who wants to join an OBGY, ma'am is medical college mein zyada cutting hai, wahan cutting hai, they will just keep asking cutting kahan hai. But do you ever wonder, a surgeon is not the one who cuts or who knows to cut. He is the one who knows when not to cut. So learning the intricacies of the things, that is the pre and the post, matters the most. And that is something which you will learn only in your residencies. Once you become an SR or a consultant, nobody is going to teach you the pre and the post thing. That is the time you will keep learning surgical skills. And these are the things which you learn throughout your life. But the basics, which is taught in residency, there is no shortcut to it. Don't skip that. Manage your patients, optimize your patients preoperatively well, see the surgeries, get involved. So even when I was doing a fellowship, I did a laparoscopy fellowship. Laparoscopy is a long learning curve. Even when doing fellowship for first 3 months, I was not made to scrub and stand there and get the instrument in my hand. So my consultant used to tell me, ki, watch the surgery as if you're performing it right now. Every day, watch it with that depth that you're doing it. When you will actually do it, and like even for cesarean, when you will actually do your first cesarean, you will not feel that you're doing it for the first time. Your observation, your skills, your involvement should be that deep. Secondly, don't give up. Like residency is a time when, there will be thousands of times and thousands of reasons when you want to give up. But every time there has to be one motivation which tells you from within, don't give up. As Dr. Adarsh rightly said, you should be reading patient-centric. Any patient you see in the ward, go back and read. Even today, when we see people are not clear about anemia and pregnancy, and we are like anemia capital of the world. Like especially if you see pregnant women, you will find 70% of pregnant women suffer from anemia during their pregnancy. But do you know the depth of it? एग्जाम्स में ना कभी बहुत हाई फाई चीजें नहीं पूछी जाती. दे विल नॉट आस्क यू ये ट्रायल वो ट्रायल ये क्या था वो क्या था. दे विल आस्क यू बेसिक्स एंड यू विल बी स्टक इन बेसिक्स. Basics and the roots are the things that you need to clear during your residency years. First year, as Dr. Adarsh has clearly, demarcated first year, second year, third year, how your approach should be. When I was a resident, first year you learn in wards. आप जितना time ward में spend करोगे, you will learn. Don't run away from the work. Seniors ne kaam bola hai, you get agitated, you get irritated, you feel that you are being harassed. But understand there is a reason behind it. Don't feel demoralized, don't feel bad कि इतना सारा काम मुझ पे डंप कर दिया, उसको नहीं दिया. We get into the habit of comparing with our own batchmates कि उसको ज्यादा कटिंग मिल रहा है, मुझे कम मिल रहा है, मैं ज्यादा काम कर रही हूँ. Stop getting into that rat race. You will get what you need to get, and you will learn what you have to learn. I never used to, run around and do, lick everybody's foot, ki ye surgery kara do. Any seniors, but whatever work they would give, I do it with sincerity. But I would not just lick around ki haan extra case mil jaye aaj. That was never my motive. When you stay focused and clear and dedicated to your patients, things fall in place. Your work, your quality of work speaks for itself. One point, additional point, if you give to your patient, if you go back and read something, you will definitely find something new which you might have not done for that patient, and you will go back and try to improvise, be it an investigation, be it a new diagnosis, be it something that which is not being diagnosed, you went back and read. So I'll give you one example. There was when I was in AIIMS as an SR, so it is not that reading stops when you are just a JR. Even in your senior residency, you should continue reading. There was a doctor couple flew down from AIIMS Rishikesh. Both of them were consultant at AIIMS Rishikesh. The wife, she was pregnant with a second child, and she was diagnosed with bronchopulmonary sequestration of fetal lung. It's a very rare complication. There was recurrent pleural effusion in the fetus. So they attempted a pleuroamniotic shunt, was done in Apollo, Delhi. The shunt got blocked or it got dislodged from its place. The pleural effusion kept on forming again and again. So we were just following up the patient with scans. Pleural effusion was there. We were feeling desperate, could not do anything. We did a couple of fetal thoracocentesis transabdominally. But it's an invasive procedure. You cannot needle into the fetus every time. Everybody was feeling very helpless. What is the best thing we could offer to this patient? Shunt was the only known solution till that date. We tried to contact all the shunt suppliers all over India with all the fetal medicine centers, and there was no shunt which was available throughout India, because that was the time, because for the Make in India, there was a change during that time policy of government, and there was no shunt which was available currently. Plus, then we contacted J&J and Cook's company, and then we thought we could get one shunt airlifted from Dubai. See, being in AIIMS, you have certain advantages that, everybody comes into play. Ministry also helps. You get things arranged. So, on repeated scans, we felt that what if we get the shunt lifted and we are not able to place it because of the fetal position? That was a very desperate kind of a moment. We thought, let's not go ahead with it. Somehow, once you're so much attached to your patients, now you work desperately and you want to really help them. We were reading papers. One night I came across a paper from Japan. There was only one case series of 4 patients successfully treated for a bronchopulmonary sequestration. 2 fetuses survived in the world, where they had done a radio frequency ablation of the feeder vessel, which comes from the aorta, supplying that BPS. So we had a fetal medicine discussion. I went and gave this idea to our consultants. They had done multiple RFAs on twins to separate the twin placentae, but they had not done this for this indication. So this idea came up. I got the printout. So I discussed with the couple, because they both were doctors. They were coming from an understanding background. They were ready to take this risk. COVID times were there. It was around between the second and the third wave ke beech ka time. And somehow they got convinced. Our consultants were convinced that let us give it a try, because anyways we were not helping that patient in any other form. We went ahead with that RFA. While doing the procedure, the blood flow did not stop. On color Dopplers, blood flow still persisted. Everybody was a little sad ki, okay, maybe it's a failed procedure, whatever. It was a big hype because it was the first procedure being done in the country. But we were a little disappointed that probably it's a failed procedure. Next day, 2 days later, all our consultants in the fetal medicine unit were down with COVID. And 2 days later, me and my fetal medicine fellow, we were doing the scan and the blood flow stopped. Completely blood flow had gone. So this is just a simple example. One desperate attempt to help your patient can make a life-changing thing for your patients. So whatever you do, whatever you learn, whatever you do, just focus कि मैं patient को कैसे जाके help कर सकती हूँ. You'll become an excellent academician. You will become a good clinician. You will be the best surgeon. You will be a good resident at the end of the day, I think. So this is all that I wanted to talk, and just a small little example. Stay out of stress. ऐसा बोलने से stress नहीं जाता है. Party with your seniors. Go hang out with your colleagues. Have a lively environment there. Like our staff nurses were so helpful. अगर हम लोगों ने खाना नहीं खाया, we did not have breakfast, they would give us their breakfast. They would specially make tea for us in the ward and give us. So it's about the vibe that you carry. It's about how cheerful you are all the time. Stress is there with everybody. I think just if you are cheerful, it gets vanished. things are taken care of on that. So that's it. Just a small little thing there. Anybody wants to ask any questions? Participate in conferences. I think that is one thing. Present posters wherever you can, present papers. It will give you the motivation to go back and read. It will give you that eye to look if this is an interesting case, I can present this. You'll go into the more depth of it. In my first year, in the third month of my residency, when I joined, I was down. When I joined PJ Chandigarh, I was down with hepatitis A. My T bill was around 12 with yellow sunken eyes. I had joined PGI. 15 days I was working. I could barely walk from one end of the ward to the other. I would be tired, exhausted. Third month, and I presented a paper on uterine artery embolization, and I won the first prize there, beating all my seniors. Came into the bad eyes of the seniors, but that gave me the motivation ki yes, you can do it. And it gave me the motivation to study also. And one more thing, you should be interdepartmental. Whenever somebody is coming from the other department to give a consultation for your patient, don't just run away कि ये मेरा काम नहीं है, बाद में देख लेंगे notes. Stand there, discuss your patients. Being an OBGY, there was a famous saying, one of the consultant used to say कि OBGY वालों का दिमाग ना pelvis में होता है. And I felt that so bad. That hit me so hard before I joined OBGY. That day I knew I want to know my patients from head to toe. If it's a neurological problem in OBGY, I have to know it in detail. I will go to the neuro people and learn what is it, why is it happening, how can you better manage the patient. If it is a thyroid problem, I have to know the entire thyroid. If it is a GI problem, accompanied my patients to get their balloon mitral valvotomy is to be done, PMBV, when we do it around 32 weeks. I would be the one volunteering and going ki I'll do the fetal monitoring there, see how things are done, see how uterine artery embolizations are done before placenta creta is being operated. Accompany your patients. Seniors bolte hain na ki so PGI has a habit, first year ko na, first semester JR को छोटू बोलते हैं. I used to feel कि प्यार से छोटू बोला जाता है. Later I realized 3 महीने बाद कि काम करने वाला घर में छोटू होता है, इसलिए छोटू बोला जाता है. So you have to work. There's no shortcut to it. There is no way going out of it. So that's it. Anything anybody wants to ask? Just a simple small conversation. I thought I should keep it to that.
All practical tips. Quite practical. All of it is going to be very helpful for the next 3 years.
Yeah, and up to date download kar lo, even till date, even till today, SR ship maybe even now. Anything I have to read, I just stick to up to date. Nothing beyond that.
चल चालू करता है बाब.
Gold standard.
चालू करता है, डाउनलोड कर लेते हैं बाब.
Yes.
Any doubts, question?
Just any other questions? दो इतने अच्छे एक्सपर्ट्स आपको मिले हैं, आप पूछ लो, अभी मौका है, दोनों से पूछ लो जो जो चाहिए वो. आई एम सो हैप्पी. मुझे लगता है कि वापस मुझे पीजी ज्वाइन करना चाहिए, आप दोनों इतने अच्छे अच्छे टिप्स दे रहे हो तो. और आई एम वेरी हैप्पी कि आरती इज कन्वीनर ऑफ दिस सीरीज. So just don't look at the numbers, how many people have joined. That is not important, because this session will be uploaded on the YouTube also. तो सेजल और कुछ पूछना है तो पूछ लो, because I feel this is like a family get together, and your the elder brother or sister is giving you advice like that. And I'm happy Lakshmi and Monisha, they are doing PhD, so I think this discussion is helpful for them also.
Very honored to even have both of them so close to ask, to get knowledge
Yeah.
there.
So you can ask Adarsh anytime. So you can, remain in contact with him, because AI and all this technology is very, it's like we are illiterate, we can say. We just know how to operate. I mean, use WhatsApp, that's all. No other technology. So regarding AI, you want to ask him anything else, Sejal?
Yeah. We have a question. How to have the motivation to study after ward work? It's very tiring.
Achha, she wants to ask Aarti. Is Aarti around?
It would be open for
Yes, ma'am, I'm here.
Yeah.
I think just read for 15 minutes a day is enough. 15 minutes you can definitely take out. Go back and read a small topic. You need not read the entire anemia. Just read diagnosis one day, read investigations the other day, read treatment the other day. Just small, split it up. And in ward, whenever you're getting time, just sit there and thoda sa read. Read in splits, at least in the first and second year.
What about these platforms, Aarti, the PG platforms, when they can join and how they can follow this?
I think, ma'am, they should join this as early as possible. So I should not advertise, but I'm a faculty at Conceptual OBG by.
I'm not trying to say advertise,
Yes,
but then
but
just to guide
yes.
them, that is, they can join any platform for that matter.
Yes,
but then
definitely
when they should, that's it.
There are multiple platforms, but I feel they should join as early as possible. They should not wait it for the third year or the final year, because since first year when they start listening, they know what to read and around what to read. Because otherwise you are feeling lost half of the times कि कितना पढ़ना है, कितने depth तक पढ़ना है, कहाँ से पढ़ना है. So you don't feel lost when you have a mentor right from the very beginning of your residency.
Yeah, that is very important. You have a mentor to guide you, because otherwise, even, they can keep on discussing. Otherwise, sometimes, the tiring day and then they are stressed out. So even they will be able to ease themselves, when they are talking to the mentor.
Absolutely.
Yeah.
Especially we have mentorship programs with us, and you should have one mentor, one guide, one person in the faculty who's guiding you throughout, like holding your hands like a baby and guiding you. Should have one person, be it your SR or be it your consultant.
Right. So anything else you want to know, Sejal, regarding AI or the technology during residency, how to use?
Yeah, maybe on that, like how do we, other than putting books, PDFs directly in the AI and like asking them to frame questions, how else can I use AI to the maximum first year if I have to?
You are in Obs Gynae, right?
Yes.
For medicine, most of the part is you have to just whatever the problems are coming, you have to just find the answers for that. So it is a bit कि पढ़ने वाले ही most of the part है. You do not have to perform the surgeries. तुम्हारा सर्जरी में तो थोड़ा सा आपके में उसमें practical aspect भी आ जाता है, hands on भी चाहिए होता है. So for that, even on the WhatsApp, people are using in some colleges, like there is while there are groups of the patient groups, any patient bed number groups they have created, and while the conversation is going on, they are asking the Meta AI about the recent any research article in the Pico format, which would summarize, which would give the evidence on that topic. Even in the surgery also, you can ask if there is any complication. So you can tag Meta AI ki, at the Meta AI, could you please give evidence for what is the complication rate, or in other parts of the world, what are the complications us tarike se. So that's one way in which we are using. And for other things, like in ChatGPT, you can ask questions for the differential diagnosis. It would help you in learning also, like once you have seen the patient, and in medicine, once you have a set of differentials in your mind, you have, then you can also put a summary, what the impression you have put, or the summary that you have made in the ChatGPT, and then you can ask it to generate the differentials. So you can see whether you have missed any differential, or you can also search for the points in favor or points in again. But it will help in strengthening your learning. Like that work was initially done by a senior or by a peer or a faculty. That work could be a step ahead. Like you can use AI to do that. It can give you confidence if you have any missed any differential, or you want to put more differential, like that, points in favor, points in again, it will make you think more like that.
Definitely.
In the learning part, in the academic research part, there are various tools for writing and for searching the research articles, so that we can use.
Yeah, I was about to ask you regarding research also, because that is also one of, it's important aspect, right from the residency, you should know how we should be, because whether you go into the academics, then obviously you have to have the research publications to your credit. So some points on that, on that.
Till the time of research, ऐसे मतलब इन द समटाइम्स व्हेन वी आर यानी यूजी में ऐसा लगता है कि रिसर्च वुड बी वेरी फैसिनेटिंग, ऐसे एकदम से लगता है कि फैसिनेटिंग कुछ अलग सा निकल के आएगा, और यानी देन अगर हम कोई ज्वाइन भी कर लेते हैं यूजी में, यूजी टाइम पे कोई रिसर्च, बट बाद में पता चलता है कि इट इज़ ए मतलब यू नीड टू बी कंसिस्टेंट, मतलब इट इज़ थोड़ा सा लॉन्ग जर्नी होता है. You first do the research and then write, so that is a long journey. So आई मीन टू से कि एक बार गो थ्रू, मतलब वंस यू हैव एक्सपीरियंस, तो यूजी तक मेरा एक्सपीरियंस था कि यूजी में मैंने एक दो रिसर्च स्टार्ट की थी, आई वाजंट एबल टू कंप्लीट, मतलब मैं उतना कंसिस्टेंट नहीं रह पाया, मोटिवेशन डाइड. बट जो थीसिस वाला था, एंड देन विद माय मेंटोर, जो मतलब वो ऑब्सगाइनी में, मतलब वो एंडोक्रिनोलॉजी है, बट ही यू सीज जीडीएम वाला पार्ट, सो माय बोथ टॉपिक्स वर रिलेटेड टू दैट. So a good it is important to have a good mentor, because when he taught me how to write the research article, how to frame a research topic, and then how to conduct a research, then I got interested, and now matlab, I feel that research matlab, I find the research enjoying. So for that, matlab, once you find it enjoying and you understand that it will take some time, you will have to be consistent ki you are doing the steps of the research, you cannot leave in between. So once that would happen, you would complete it, and once you publish it, then also you get motivation ki aage ka bhi. It would be better if Sejal asked any specific question regarding the research, or if she had tried any problems faced.
Right now, I'm still looking for a topic for my thesis, so I'm going through that to even know what exactly I want to research, and it's still difficult, like to where to progress and like what topic to select.
But it is good to have if you have a topic of your interest, it is good to communicate. But even if your mentor or your thesis guide gives a topic, do not be कि उन्होंने क्या topic दे दिया ऐसा. Main aim is to learn the research methodology. So whatever study you are seeing, like if you are taking an RCT or a retrospective any observational study, I think read about that कि what are the strengths of that, what are the limitations of that, how will you actually monitor. Most एक बार जब करोगे तभी बीच में पता चलेगा कि पेशेंट रिक्रूटमेंट में क्या प्रॉब्लम्स होती हैं, उनके इन्वेस्टिगेशंस यानी डिफरेंट टाइम पे कराने में क्या प्रॉब्लम होती है, वो तो एक बार करने के बाद ही पता चलता है. बट मेथोडोलॉजी वाले पार्ट पे फोकस ज़्यादा करना रेदर देन द टॉपिक दैट इज बीइंग गिवन.
Okay.
मतलब अगर टॉपिक कोई भी मिल रहा है, देन इट इज फाइन, ओनली लर्न द वॉट एवर वॉट मेथोडोलॉजी इज.
Okay.
एंड थीसिस के लिए मैं वो बोलूंगा कि थीसिस का टॉपिक थोड़ा सा इजी रखना, एंड थोड़ा सा जो कंप्लीट हो सके. डू नॉट मेक द थीसिस योर स्ट्रेस वाला पॉइंट. मतलब मेरा भी हो गया था, मैंने भी जोश जोश में ले लिया था, ये सर ने बोला आरसीटी कर लोगे मतलब हो जाएगा. और सर ने ये भी बोला था कि उनके जो डिपार्टमेंट में मतलब दे वुड बी जो रिसर्च असिस्टेंट होते हैं वो भी दे वुड ऑल्सो हेल्प. बट वंस यू स्टार्ट डूइंग, यू हैव टू डू बाय योरसेल्फ. So do not fall into that trap. So thesis topic, keep it simple. But if you're interested, if your mentor is good, collaborate on other research any topics with him. So my thesis hasn't been published because the original sample size was 120. I could complete only any 60. But my meta-analysis was with him only. So that has been published. So that is important. Keep your thesis, do not
As simple as possible.
hard. As simple, low sample size, and simple. Collaborate on other topics with your mentor or other faculties for research objects. Write the case reports, all that also.
देखते हैं अभी क्या टॉपिक. ओके. और फिलहाल कुछ है नहीं. इट वाज अ ग्रेट सेशन. बाकी किसी ने क्वेश्चन.
I think Dr. Aarti has answered in the chat itself. You can read the question as well as answer for the others. Otherwise,
The question was, I'm doing my DNB OBGYN from a secondary level government hospital. The hands-on is very good, but again, we can't manage complications and refer patients. I did my MBBS from a tertiary medical college and feel disappointed when such a situation arises. Any advice? So regarding that, ma'am has answered, you just have to give your best to the patient what you can, and sometimes you can't do a thing beyond that.
So both the sessions, they were very excellent speakers. So we are very happy that you both were here and you took out time from your, in spite of busy schedule. I know even Aarti was traveling and still she joined the session. So it was really very informative for us also, even though we are now I am 50 plus and practicing for last 25 years. Sejal is my daughter. So I thought, we should have such sessions for the residents right from the beginning. So thank you so much, Dr. Adarsh, as well as Dr. Aarti for joining and giving us, your valuable time. Thank you. So hand over to coordinators for the further proceedings. Yeah.
Thank you, ma'am. It is always happy sharing and talking with the friends.
Thank you. Yeah.
Thank you so much, ma'am. Thank you for having us
Yeah. Thank
on
you.
this very interactive session.
Yeah, it was like a family discussion only, I felt. It was not like a Zoom meeting, official. It was like a family get together. Thank you so much. And I liked,
Thank you, ma'am.
it was like your experience sharing. So it was like directly from your heart, So the talk was heart to heart talk. So it was really appealing. Good.
Thank you, ma'am. Thank you so much.
Thank
Thank
you.
you.
Thank you so much.
Mm.
Thank you.
Thank you so much, Dr. Adarsh, for your contribution and being here. Thank you so much.
Thank you, ma'am.
Bye. Good night.
As this session comes to a close, I am highly honored to express heartfelt gratitude to each of you for making this session a huge success today. And thank you so much, Dr. Adarsh Pal sir and Dr. Aarti Chitkara ma'am, for sharing very valuable insights with us. Thank you so much to our coordinators, Dr. Lekhi, Dr. Sejal, and Dr. Lakshmi, for managing everything so beautifully behind the scenes. And thank you very much to our conveners, Dr. Alka Patankar ma'am and Dr. Shubhada Neel ma'am, for always supporting us to conduct these sessions for benefiting everyone. Next, I would like to share a couple of important announcements regarding our upcoming programs and events for everyone's benefit and future reference. This is the flyer of our upcoming event. You are warmly invited to attend our upcoming webinar on digital wellness, a perfect opportunity to pause, reflect, and rejuvenate yourself. It will be conducted on 22nd June from 9 to 10 p.m. by an esteemed digital wellness coach, Bala Kishore sir. Next is that fill the Google form to be a part of the support circle. Please find its link in the chat box. You can also join our WhatsApp group to receive important updates regarding the upcoming events. We are also sharing this link in the chat box. Also, we request you to join and motivate others to attend this special session on every second and fourth Sunday of month, either at 11:30 a.m. to 1 p.m. or 9 to 10 p.m. as per the availability of the speaker. You can also watch, like, and share the recorded session on the Divine Garb Sanskar YouTube channel. For personal counseling, please feel free to reach out to our coordinating counselors for any guidance or support. Let's stay connected and inspired on our journey of inner excellence. We look forward to welcoming you to our next session on 22nd June titled Digital Wellness, and we have as our resource person very well-renowned faculty Bala Kishore sir. Looking forward to meeting you. Thank you and wishing you peace, power and performance ahead. Thank you everyone for joining us today. Let's close this session by immersing ourselves in the soothing melodies of a beautiful song, allowing its divine vibrations to fill our hearts and minds with peace. Thank you. Good night.
शुक्रिया आपका प्यारे प्रभु, शुक्रिया शुक्रिया आपका प्यारे प्रभु, शुक्रिया मुझको जीवन दान दिया, अपना बना लिया।
शुक्रिया आपका प्यारे प्रभु, शुक्रिया।
भूल गए थे आपको कई जन्मों की उलझन में, ढूंढते थे आपको, पुकारते थे कण कण में। पिंजरे के पंछी को गगन में उड़ा दिया।
शुक्रिया